day 13 of recovery from the hip replacement. I am on the way to Taipei to see my doctor for appointment and give him back the crutches. Right now I am on a high-speed rail to Taipei. So as you see, almost every seat is empty, and all the cars looks the same way. I am very interested how will the metro look like in Taipei today. Anyway, well, that's good. Less possibility of any infection. See you later. Hi, check out Taipei metro station. Also very few people. Usually it's plenty. But today is empty. Almost empty. Due to COVID-19 partial lockdown, level 3. Look at that. And also not many people on the MRT, on the metro. So it's kind of safe and empty. I mean, empty and safe. Nice to travel, plenty of seats and plenty of space between passengers. That's really good. And here I am at the Longzong Veterans General Hospital in Taipei, and it's raining outside. How nice! In Taichung, where I live, it doesn't rain now for many months. We actually have a drought. Almost no water. Okay, let's see what doctor says. Look at the apartment area. Very empty. So this is Dr. Yang,
Hi.
my doctor, and I would like to ask him a few questions. So this is my X-ray,
Yes.
which doctor said is excellent.
Yes.
And I would like to ask questions maybe for all of us to for people who will be watching it now or in the future. How do we prevent overwearing our hips? How do we protect our hips from distraction?
Okay.
Yeah.
The question you asked is how to
Prevent, yeah.
Yes, the joint cartilage wear, right?
That's right.
The reason for the cartilage wear may be two major. One is the trauma.
Trauma. Oh, yes.
Maybe like a falling accident or a traffic accident, and another is overuse.
Overuse.
Why
Yes.
overuse? Maybe you too much exercise on your hip, like you like running or
yeah.
mountain climbing or weightlifting.
Weightlifting, yeah.
Yes, it will make your cartilage wear more aggressive than others. And besides that, the weight control is very important. Not make your weight too much.
Not to carry too heavy things.
Yes,
yeah.
yes. And your body weight, you must take care to your body weight.
Of course, yeah. Not to become obese.
Yes, because the body weight will make efforts on your cartilage wear. It's very big influence compared with the knee. The hip with the first
is the first major joint.
Yeah, major joint.
Doctor, what point should we seek help? When because people feel some pain, but at which point it would be critical to see doctor?
Okay, the pain originates from two kinds. One is muscle, and one is a real joint.
Real joint, yeah.
If your pain origin from is the lateral side or posterior side, the major problem maybe come from muscle. We call it soft tissue. But if you have a growing pain, you must pay much attention to it. If your pain is happen when you're walking, it's more than origin from your joint. But when you are rest, you feel pain. It's still origin from the muscle.
I see.
And even you if you want to distinguish these two kinds, you must visit the orthopedic doctor. because the rehabilitation doctor cannot distinguish.
Cannot distinguish these
yes.
two. Yeah.
Yes, you must visit an orthopedic doctor, especially subspecialist in hip joint.
Yes, of
or
course,
knee
specialist. Yeah.
joint. Yes.
Thank you, doctor. The final question I have: how do we? Could you, because you are specialist in the direct anterior approach, so how could you speak a little bit about it? What's the advantage, and why should we seek doctor or a surgeon to do that?
Okay, because we have three major kind of approach to the hip joint.
Oh, okay.
Anterior approach, lateral approach, and posterior approach.
Posterior approach, yeah.
But unfortunately, if we want to do the joint muscle preserve, muscle sparing surgery, only direct anterior approach can do that. So if you do the direct anterior approach, you can make faster recovery because we don't cut your muscle. So you can distinguish, if you do the direct anterior approach, your gait will be normal than non-surgery patient. So if you do the lateral approach or posterior approach, even maybe 2 weeks or 4 weeks later, you still walk with a limping.
Yeah.
Very obviously.
Obviously, yeah.
Yes. So if you want to do a faster recovery, you can try direct
anterior approach.
Yes.
And there is basically total advantage of this technique.
Yes.
There's no disadvantage of any. I mean, would you say there's other?
Yes, compare other approach. The most part is not destroyed.
Yeah, the muscles are not destroyed.
Yes.
Could you quickly describe how it is done? So there's a cut, and then what happens to the muscles?
We don't cut. We just spare.
Yeah.
We go through the hip joint through the muscle interval. So we don't interfere your muscle.
I
just
see.
Stretch it.
So they are stretched out.
Yes, maybe you can feel some temporary numbness or some kind of, but because we spare it. But fortunately, we did not cut it, so the damage is temporary, not permanent.
Yeah.
But if you do the lateral approach or posterior approach, you must cut the muscle. The damage is always be happen.
Yeah, always will be. Yeah, severe damage.
Yes. It's not temporary damage. Yes.
Thank you, doctor, very much, and thank you for looking after me so well. Sure. Thank you for your operation.
Okay.
So everything seems good. My muscle, the feeling of some burning or pulling, doctor explained to me, is due to tissue regrowing or repairing itself. So everything seems good. Well, and doctor advised more exercise, actually, even more than before. Careful, not too much, but more. And I'm on the way back home. Goodbye, Veterans Hospital, until July. I have appointment in July. So that's it for today. Probably, depending how I feel, I will or not do exercises for today. Bye bye. See you. Okay, I'm on the way back from bus to train station. As you see, some monks are praying. Well, at least this one is praying, and this one is just sitting and checking cell phone sometimes. Well, I just saw him checking cell phone. So anyway, those are kind of interesting things about Taiwan, and plenty of many shops, little shops to buy. It doesn't seem like very serious COVID situation, so people are still buying stuff, not really distancing. So I think, considering the number of the COVID outbreak we have, comparing to number of population, that's really very small percentage. Anyway, let's hope all will be fine. I'm on the way back to Taichung. Probably the MRT metro will be also kind of empty, which is good. Plenty of places to sit. The MRT is still pretty empty. Even this is kind of afternoon hour. It's after 5 when everyone should be going back home, coming from work. Really amazing. That's level 3 semi-lockdown in Taipei, which is good because I think the virus will be very quickly contained. So that is actually good news that people really do not travel much. That's really good, I have to say. This is really excellent. And as you see, we have very few people again. 1, 2, 3, 4, 5, 6, 7, 8. With me is 9 in this car. And all the other cars are in a high-speed train are the same, empty. So that's really very safe. Same as stations and so on. Okay. Yeah. I think I will finish for today, because this will be already long video. Thank you for watching. Hope you like that. Everything is fine. Tomorrow I will report my progress, because today I think I've done enough walking for a day, so I decide now not to do exercise tonight. Maybe tomorrow morning rather. Yeah, I'm a bit tired. I use the leg a lot. So yeah, thank you very much from Taiwan. I'm approaching Hsinchu. Soon I will be back home in Taichung. Bye bye. Keep safe, keep well, keep strong.